Really excited to have you join me today, Dr. Houman. I know your practice is thriving out on the West Coast. You are well known in the fertility community and have an interesting background as a urologist. For those who don't know, explain to our listeners what a urologist does and what led you down the path to specialize in male fertility.
Great question. So yes, I am a urologist. We primarily specialize in issues of the urinary tract. So the kidneys, the prostate, the bladder. And we have a lot of subspecialties within urology. We have male infertility or men's health, which is what I do. There's female urology, which is a big portion of urology, or urogynecology. There's pediatric urology. We deal with a lot of cancer, so there's urological oncology as well. There's a number of subspecialties within it. Urology, believe it or not, it's a very competitive field to get into. And the reason I went into it, my father's actually a urologist as well, but I knew I wanted to be a urologist. Once I became a urologist, I saw the need in dealing with young men and their issues when it comes to sexual dysfunction, fertility issues. And at the time, this was about 5, 6 years ago, there weren't many fertility specialists, even here in Los Angeles. So I saw the need for it, and I thought it'd be a unique opportunity to help young men who weren't different in age than myself at the time. And so far, it's been very, very fruitful and very satisfying from my standpoint.
Good for you. So male infertility is on the rise. It's quite common now, unlike in the past where it wasn't really discussed, it was taboo. How does someone know they have male infertility? What are the symptoms?
There's no real symptoms associated with male fertility, and that's the problem. A lot of guys are like, I'm healthy, I eat right, I sleep right, I exercise, my stress is low, but I'm on testosterone replacement therapy, for example, or I use a sauna and jacuzzi on a daily or weekly basis, or they've just been otherwise healthy, but they have no idea that they have low sperm counts. So really the only way of truly knowing is doing a simple test called the semen analysis. There's traditional ways you do it at a doctor's office. You could do it at an office like myself or any other fertility clinic in your area. But now there's newer, easier ways of doing it online where they send you a kit, you do it at home, mail it back, and you have your result back within a few days.
Wow, that's great. That's so fast, especially with today's technology.
Exactly.
So, for the semen analysis, is there a difference in someone providing a live sample right there with you versus someone providing a sample at home and sending it into the lab?
In terms of the quality or the
Mhm.
accuracy, no, because these companies they have these special preservatives that work, and then there's regression models. So based on the timing of when you submitted the sample to when the lab receives it, they have these models that are able to accurately assess what your semen analysis, what your sperm parameters were if you checked it immediately after ejaculation. So they're accurate and they're a good gauge of fertility overall. But more importantly, it increases access for a lot of guys who otherwise have issues going to a fertility clinic and dropping off a sample.
Hmm. And so, why aren't semen analysis done more often, given the prevalent stats that are out there?
It's one of those things where, number one, if you think about it from a male standpoint, each time he's ejaculating, there's tens of millions, sometimes hundreds of millions of sperm coming out, and all you really need is one, right? One needs to get to the egg. Female infertility is obviously a little bit more difficult to overcome because each month in a 30-day period, only one egg is coming out, right? On average, only one egg is really coming out. So it's although guys have, male infertility is an issue, a lot of times it's overcome by months and months and months of trying, which a lot of couples end up doing without ever, for a guy, ever checking his semen analysis. So yeah, that's kind of the reason why male factor infertility isn't such an issue. But more importantly, semen analyses. I think there's a taboo with men wanting to know that they have infertility issues. Men are there's this machismo or I'm a man mentality where I don't have any fertility issues. Why would I? And when you find out, obviously it could be quite sobering, but more importantly, yeah, I mean, it's a difficult piece of news for anybody to digest.
Exactly. So with women, we are told that after trying for a few months, and depending on the age, to go see a fertility doctor. When should a man be concerned about their fertility when something is not happening? And also, what do you recommend to your clients before should they go see you before they start building their their family? Should they get help right away, or should they be trying at home for a bit?
So the earlier the better, right? With anything in medicine, truly anything in medicine, the earlier the better. The earlier you intervene, the better. Um, there's no hard and fast rule when it comes to infertility and when you should see a specialist. Historically, the understanding was 12 months, but I'll tell people if you're struggling for 3 months, 4 months, 6 months, get on it, right? Not just the male partner, but also the female partner, both you guys. From a male standpoint, check a semen analysis, make sure everything's okay. And then the female part, same thing. See an OBGYN, do the necessary blood tests, do the necessary ultrasounds to make sure everything's lined up. Because the thing from a male standpoint, if you do make a change, whether it's a lifestyle change or diet change, not doing jacuzzi, steam rooms, whatever it is, it takes about 72 days from the time of the sperm is born for it being ready to be ejaculated. So that's about 3 months. So it does take some time in order to see the necessary changes that you've made. And that could add, for some couples who are towards the later stages of their fertility window, those 3 months could play significant role.
Yes, definitely. Time is of the essence. So
Precisely.
there's so much concern for women getting into their 30s and ovarian decline, not yet ready to have kids, so they'll opt to freeze their eggs. Should men start thinking about banking their sperm and even declining sperm quality?
Absolutely. So I'm a big believer in that, right? Again, there's no hard and fast rule on this, but why wouldn't you, right? It's an insurance policy. Worst case scenario, and these days sperm banking is quite cheap. It's a couple hundred a year at most, but it's a perfect insurance policy because reproduction, sperm quality declines with age, absolutely. Egg quality declines with age as well. But there's no harm in banking your sperm from an early age and using that sperm if you actually need it later in life.
Is there any kind of procedure that you go through to ensure that you're getting an accurate sperm count?
From a semen analysis,
Mhm.
really, not really, but the one thing I would tell guys is give it a few days, at least 72 hours, at least 48 hours from your previous ejaculation before you give another semen sample. Ideally 3 days, so about 72 hours. But if you're able to give that buildup, a little bit of buildup of 3 days, we're able to get a much better assessment of your fertility depending on those semen parameters.
Mhm. What is varicocele?
So that's a good one. So we know that I don't know how familiar you are with varicose veins of the legs. So varicoceles are varicose veins of the testicles, and the reason why that plays a crucial role or impacts fertility in negative ways, the testicles like to live within a very narrow temperature range, and the scrotum basically it's a thermostat. When the body's cold, or when the body's too warm, the scrotum relaxes and it pulls the testicles away from the body. When the body, or when it's too cold outside, it tightens up and pulls them closer to the body in order to maintain that narrow temperature range. Now, why varicocele plays a role is blood pools around the testicles because the blood isn't able to get back to the heart. That's what a varicocele is. And blood is warmer, so it throws the testicles out of that normal temperature range. And what it does is it negatively impacts sperm quality. It can impact the counts in a negative way, but it could damage the sperm DNA as well as impact the motility, the way the sperm move, as well as the way they look, all of which could really negatively impact fertility with your partner.
What is ICSI and how effective is it?
So we're in this new, not so new anymore, but now we have IVF and ICSI, which have changed the way a lot of couples have been able to conceive, couples who have had challenges before. So IVF is the idea of getting an egg and a sperm and using a test, putting them in a test tube, if you will, and letting the egg fertilize, having the sperm fertilize the egg. ICSI is different than that. ICSI is taking it to the next level where we actually pick the sperm and we pick the egg and put them together. It's not so much of a natural process. It's literally putting, we're choosing which sperm and which egg to put together. And that, again, that's the advanced version of IVF.
That is so helpful. What are the best ways to take care of sperm health and count?
So what's good for your heart, what's good for your overall health, is good for your fertility in simple terms. So I would say I would simplify it in four different things. Eat right, and what I mean by eat right, well, I'll take a step back here. Lean proteins, healthy fats, and try to minimize your carbohydrates as much as possible. And if you're going to eat carbohydrates, complex carbohydrates, those ones that don't throw off your sugar levels. Exercise a couple times a week of heavy weightlifting, mix in some cardio in there as well. Sleep, try to get 7 to 8 hours of sleep a night. And the last one, which is the hardest, is stress, minimizing your stress as much as possible because that's good for your hormonal health. Those are the four mainstays. But then the other thing I would tell you is minimize any excessive temperature or heat to the testicles. So as I've mentioned, jacuzzi, saunas, steam rooms, even laptops on the lap, cell phones in the pocket. Try to put the cell phone in the back pocket. That could help with enhancing and or improving sperm quality.
And how does vaping, tobacco, and marijuana impact fertility?
So tobacco is an absolute no-go. It does nothing. It only negatively impacts your sperm quality. It decreases the amount of blood flow to the testicles. It vasoconstricts, causes endothelial dysfunction. All of these things that basically don't provide the testicles with the necessary nutrients that they need in order to produce good, healthy sperm. Marijuana, this is a little bit different. Marijuana, the data on it, you could make the argument a little bit on both sides. We know that marijuana in chronic usage can throw off your hormones, and we know that you need good, healthy testosterone levels in order to have good, healthy sperm, and marijuana can throw that off. However, on the flip side of it, marijuana also can help reduce your stress levels. Marijuana is an aphrodisiac for some couples, so it increases the frequency at which they're engaging in intercourse, and as a result of that, their chances of conception can be higher. But ultimately, if I would suggest if you're going to use marijuana, minimize it. Anything chronic, anything long term is no go. Less marijuana is a little bit of marijuana is okay. Tobacco is an absolute no go.
Can supplements help? Also, what if men are taking steroids or testosterone for physique?
Yeah, so I can't tell you how many times in a given week a guy comes in, young guy, healthy guy, he's on testosterone and his sperm counts are zero, and that's only because he went to one of these men's health clinics. He was told testosterone is going to make you feel great, but wasn't told about the side effect of fertility or losing your fertility as a result of being on testosterone. So any type of testosterone supplementation, where the creams, the gels, the injections, that's going to take your sperm counts essentially to zero. So testosterone replacement therapy is a no-go when it comes to fertility. Obviously, avoid that. Now, the supplements, obviously there's so many supplements out there. Can any of them move the needle that much, where you're going from completely infertile to being, having a great fertility? No. Can they move the needle? Absolutely. And it comes at no harm, right? It doesn't hurt you in any way. So the supplements, the best one out there for men and women is something called coenzyme Q. Obviously, the dosages vary for men and women, but that has the best data on it for men. And these other companies have different other supplements within them. But overall, supplements can only help.
So, what's mental health like for men on this journey? What do you see from that perspective? Do they not really talk to you that much about how it's affecting them mentally, especially when they're going through their reproductive struggles?
So it's men aren't necessarily the best at communicating, and at least when they come to my office, they're not as open about it. But some men are, and I would tell you, the struggle is real in the sense of it's humbling. It's humbling and it's sobering when you're told that you're having fertility issues. And then as you go through the late stages of the fertility journey, it could create some conflict in some relationships. I've seen it where it's, finger pointing starts to happen. But the best thing I could say is, with like anything else, with any other elements of a healthy relationship, it's all about communication. So it's not anyone's fault that this is happening. It's a team's journey. The couples are in this together to ultimately achieve their goal. And given where we are in modern medicine, the good thing is we have so many options. We have a lot of new therapies, advanced therapies, whether they're medications or surgical options, for most couples to achieve their reproductive goals.
Great information. So, switching gears, I like to ask all my guests a couple of questions. What does self-care mean to you?
I think it changes throughout the course of the year. I tell you what self-care means for me now is a good, healthy morning routine. Um, I'm kind of dealing with a more of a hectic schedule in 2025, and as a result of it, um, I've been I've been a little bit more stressed than I'd like. But the thing that helps me is a good, healthy morning routine as much as I can, and that's just includes drinking a lot of water, relaxing for the first 20, 30 minutes of the day, doing a meditation, trying to exercise, and then starting my day.
Hearing that. What is your vision of well-being?
Um, I'd say it's a combination of peace of mind, or peace from the mind, just having a good, healthy or mental peace of being peaceful in the mental state, and a body that allows you to do whatever you want.
So good. Now, if there was one thing you wanted people to take away from this conversation today, what would it be?
I would say with like anything else, I think a lot of, at least from what I do, a lot of men's health urology, they're taboo subjects, whether you're experiencing infertility or having sexual health issues, whatever it is. Two things. Number one, you're not alone if you are experiencing these issues. And number two, the earlier you address it, the better off you will be. We can nip it in the bud at a much earlier stage, at a much earlier place. And as a result of that, there's a lot less issues from your standpoint, and you could continue along your normal course of life the earlier we address whatever issue you are experiencing.
I'll leave it at that. Where can listeners get in touch with you, and what is your preferred social media?
Yeah, so as you mentioned, I'm based in Los Angeles. My name is Justin Houman, Houman, and you can find me on any of the social media platforms, Justin Houman MD.
Perfect. We'll add all of this in the show notes. Thank you so much, Dr. Houman, for speaking with us today and normalizing these conversations around male infertility. Thank you so much.
My pleasure. My pleasure. Thank you so much.